Welcome to this edition of Healthline. I'm Dr. Kevin Soden. It's an unfortunate fact of life that many of us will lose some of our teeth as we age. But if you're bothered by missing teeth or wearing uncomfortable dentures, there is another alternative: dental implants. Here to talk with us more about dental implants is Dr. Abraham Ingber, a prosthodontist who treats seniors. Dr. Ingber, thanks for joining us.
Well, thank you for having me, Kevin.
Are seniors particularly beneficial for them to get these kind of implants?
It's amazing. It's a miraculous discovery, implants. Being able to function and eat properly is not only a medical advantage for the patient, but as well as a security that she has in being able to face her family and eat comfortably. It's really a very important opportunity for her to be able to show her emotion and personality.
We'll talk more about dental implants with Dr. Ingber when we come back, so please stay tuned. Welcome back to Healthline. I'm Dr. Kevin Soden. Today we're talking about dental implants and other options for replacing missing teeth. Joining me are two dentists, Dr. George Baxter and Dr. Abraham Ingber. Dr. Baxter, I'm going to start with you. What is the difference between regular implants and mini implants?
It's very important. The difference is with a mini implant, there is a very small amount of surgical intervention in order to place the implant in the bone. With a regular implant, you get into incisions, drilling into the bone, placing an implant cylinder into the bone, covering it, letting it heal, then uncovering it again and putting in the abutment or the crown or the fastener for a partial denture.
The beauty, of course, is the size and dimension of this particular implant. And quite often, patients who have been missing teeth for many, many years have lost a lot of the gum and the bone. They've shrunk to dimensions where traditional implants cannot fit into those dimensions. So a mini implant gives patients who have very thin ridges the opportunity to create some stability for a denture. And I think that's one of the major benefits. The other major benefit, of course, is the fact that there's no incisions that are necessary. And if there are no incisions, there's no operation, then there's no inflammation. And when there's no inflammation, there's no pain. So one of the benefits, of course, is the atraumatic nature of the use of these particular type of implants.
That's true.
Tired of those dentures that just refuse to stay put? We'll have some more solutions. That's coming up next. And later on, some tips on getting those yellow teeth on the white track. Stay tuned. Welcome back to Healthline. Whether you've lost them due to periodontal disease, tooth decay, or injury, dealing with missing teeth is something many of us face as we age. But dentures often slip, pop, or flip, and that can make eating, even speaking, a chore. But not anymore. Joining me again to talk more about this are Drs. George Baxter and Dr. Abraham Ingber. Dr. Ingber, how do these mini implants help to keep these in place? How do they work to improve the problem with dentures?
The mini implants have an attachment. It's a little tiny ball that's attached to them. And inside the denture, there's a little sleeve that snaps onto the ball. So the implant acts as an anchor. Anytime you have anchorage, you have stability. And that's the whole idea, that he was suffering from edentulosum and a denture that was unstable, so that he had to remove himself from a meal, the psychology of removing yourself from a meal, the difficulty, and an anchor stabilizes that denture. That's how that works.
You can hear the click when that denture goes on there.
Yes.
Next, we'll tell you about the latest in cosmetic options to keep those pearly whites nice and bright. Stay tuned. Welcome back to Healthline. I'm Dr. Kevin Soden. Today we're talking about teeth and how to keep them looking their best as we age. I'm here with Dr. George Baxter and Dr. Abraham Ingber. Dr. Ingber, why do our teeth yellow as we age?
Part of the reason is that we consume products and foods that have a variety of different colorants in them and oxides, such as coffee, tea, tobacco, red wines.
And I think one of the things you told me outside earlier was if it stains your rug, it's going to stain your teeth. Is
Exactly.
that right? Okay.
Exactly.
Now, yesterday, I
You
understand.
stole my line.
I understand you went to get your teeth whitened because you wanted them to kind of look a little brighter and everything. And I should have gone along with you as well. We're going to roll a videotape, and I want you to tell me what's going on here, okay? And you're getting laser whitening.
I'm going to be getting a laser whitening, which is a process where we apply a whitening gel to the tooth after we've isolated the area.
And how does this work exactly? You're putting this gel on the teeth. Now, what happens exactly with the laser?
Once you isolate the teeth and apply this whitening gel, the key ingredient, active ingredient in it is hydrogen peroxide. And the laser light allows the chemical, the hydrogen peroxide gel, to be activated. And also at the same time, it allows the hydrogen peroxide, the gel, to penetrate into the enamel to attack those stains that are embedded in the enamel. We do a combination in our office. We recommend the laser, which gives you a very high boost in whitening, and then to sustain it and maintain it, we give the patient trays, and those trays are worn over for about a 2-week period of time, and we get some excellent results.
Okay.
You know, the difference between the commercial products that are available over the counter really is the strength of the materials, the amount of time the patients have to apply it, which is usually in the months and months and months. Of course, with a laser in a couple of weeks of trays, you get an immediate effect. You can see my smile. You can see what a wonderful result that I was able to achieve. And the other thing is the fade. There's always a fade. They just don't sustain themselves.
Can any of these materials damage your teeth at all?
I have known no experience in my use of them.
With an in-office, there are two ways. There's an in-office and home bleach. With the in-office, because you're using a concentrated hydrogen peroxide, if the gum tissue and the lips are not isolated, and this material is leaked out into the tissue, it can cause some sloughing of the gum tissue, minor, very minor irritation to the gum tissue. But that's about it.
Yeah,
so that's why it's very important to have great isolation.
Good. Dr. Ingber, Dr. Baxter, thank you. Wonderful information, and I think everyone will have a better smile because of that.
Well, I really enjoyed being here. Thank you so much for the opportunity.